talk to my patients about looking after their heart and having a healthy heart, I always speak to them in detail about diet, because when you think about it, your heart's a pump. It's the pump that brings the blood all around your body, and it has to function 24 hours a day. So just like an engine in your car, you've got to maintain that pump as well as you possibly can. Diet's important because diet affects the health of that pump, but also the arteries that feed the pump, the coronary arteries. Firstly, I talk to my patients about the importance of having a good amount of fresh vegetables and salad, about 5 portions. Trying not to have too much fruit, but about 2 portions of fruit per day, because excess amount of fructose are almost as bad as having excess amounts of sugar or glucose. I also talk to my patients about keeping the amount of carbohydrate in their diet down. Excess carbohydrate can lead to diabetes and obesity, and when they do choose their carbohydrates, that they focus on having the high grain ones. We do like patients to avoid excess amounts of things like starchy vegetables, rice, cakes, biscuits and chips. I do talk to them also about dairy, and it's important to have a combination of dairy. You can have some normal fat, but also low fat and lean meat. And then of course fish is very important. It's rich in omega-3, and so I do recommend that patients have about 3 meals of fish per week at least, because that's also very good for the arteries. And finally, there is one food that if you take too much of it in, it's directly linked to risk, and that's trans fat. So trying to avoid things like donuts, fried foods. They are often full in trans fat, which is very bad for your arteries.